Hi guys, today is a good day because I'm gonna show you a 3D diagram of your bones. Now, today we're gonna look at the femur. Okay, so fun fact, the femur is one of the longest bones in the body, and it's also one of the strongest. Okay, so let's take a look at the femur. So the femur has some landmarks, okay, a lot of landmarks. It may look confusing at first, but we'll go through these one by one. So let's take a look at the bottom first. So here, this is actually called the patella surface, alright? So this is actually where the patella would actually be. Now you can see this is actually where there will be articular cartilages at. So you remember this is patella surface. Down here that I'm pointing at here, right here, is called the medial epicoidals. So if there's a medial side, there will be a lateral side. Now here is called the adapter tubercle, the white one. Now the two lines at the back you see here, maybe this from here. These are called the medial and lateral supracoidal lines because they are actually lines at the back that run at the back of the femur. Right? So if we take a look at the back as well, this area is called the popliteal surface. Right, and here is actually the intercoidal line of the femur, followed by the intercoidal fossa. So this is the fossa where it actually sit above the tibia, the articular, and this is the medial and lateral coidals. So it also have cartilages on them. You can see from that 3D diagram. Alright, let's move up a little bit more. Now here, this landmark is actually the shaft of the femur. So this is actually where the vastus intermediate muscle will actually originate from. It will insert all the way down to the patella tendon right there. At the back here, this is the medial and lateral lunar aspia, right? So further up, it actually gets more easy. If you look at this depression on the femur down here, this is actually the foyer of the femur. This is where a ligament called the ligament of the head of the femur will actually originate from and hold the femur bone to the acetabulum itself. Now here is the head of the femur, the neck of the femur. This is the intertrochanteric line. So you can see that line right there. This is the greater trochanter. This is one of the big surfaces down here. A lot of muscles originate here. And at the back here, this is the trochanteric fossa. So there's a little groove down here. You can see that little pocket, kind of like a cave there. And this is the intertrochanteric crest. This is the lesser trochanter, so this is the greater, and this is the lesser trochanter. Followed by that, you have the gluteal tuberosity. It's kind of like a bump right there. You can see that. And lastly, which is the pectineal line. So, yes, this is all the bone landmarks of the femur, from the top to the bottom. So thank you so much for watching. More bone landmarks will come out soon. We're going to talk about the foot, the tibia, the fibula, the hip bones, the pelvic as well. We're going to talk about the carpal bones, the foot bone, not the foot bones, I mean the hand bones, the ulna, the radius, the humerus, scapula, clavicle, and the sacrum as well. Alright, see you next time.